Anti-anginal drugs. First, we have to know what is angina. Angina is what it is, mainly that occurs due to coronary blood flow partially obstruction, and it will cause the retrosternal irradiation type of pain, which is happening prior to myocardial infarction. So in angina, what is happening is there is an imbalance between demand and supply. It is like um, coronary chronic arterial ischemia, mm, uh, in lower limbs, right? You heard from asymptomatic intermittent claudication and restraint and ischemia and gangrene, those post stages like that. In intermittent claudication, that when you walk 500 meters, you will get calf pain. So it is with time it is progressive, like uh, the leg pain will be come first will after 500 meters, after that 400 meters, 300 meters, because due to a plaque, the blood flow uh, progressively decrease uh, to demanding muscle. So that is what exactly happening in the heart also. The coronary vessels, due to atherosclerosis, due to increased LDL and VLDL, VLDL and very low density lipoproteins, and LDL, low density lipoproteins, there's a plaque deposition in coronary vessels. And when heart muscle is increasing the demand, the coronary vessels are unable to supply the enough blood supply. So there is ischemic pain. Ischemic pain, that is what anginal pain is, right? Retrosternal irradiating type of pain. So that is what angina is. So basically, what is happening is there is an imbalance between demanding and supply. So demand is increasing, supply is decreasing due to due to plaque in coronary vessels. And heart muscle, it's like basically heart muscle says, give me more oxygen, give me more blood, give me more nutrients, mainly more oxygen, give me more oxygen. But coronary vessel says, I can't because I have a plaque. So if you remove the plaque or dilate me, you will get rid of this. This is what is anti-anginal drugs are doing. Anti-anginal drugs are not removing the plaque, they dilate coronary vessels and they try to increase the supply. So that is what is happening. So anginal plane, there's a stable angina and there's unstable angina. Huh? So in the stable angina, plaque is stable, so it's a matured plaque. In unstable angina, it is immature plaque. Anytime it could be ruptured. I mean, there's a platelet could be aggregate and there could be proceed into myocardial infarction due to no blood, no supply. But in angina, there's a supply, but it is not enough. So there's a thin line between myocardial infarction and angina. Angina is there's imbalance between demand and supply. In myocardial infarction, there is no supply, demand is increasing, and ischemia, myocardial infarction, ischemia, infarction, heart muscle will die. um, so that is what is happening. So anti-anginal drugs, it is basically dilate coronary vessels and try to increase the supply. So mnemonic is KNBC. First, we are not talking about K because in the anti-anginal drugs, main thing is glycerol trinitrate, nitroglycerin. They are the main vasodilator that we are using for anti-anginal drugs. That's why I took N firstly. N means for nitrates, nitroglycerin, isosobide dinitrate, isosobide mononitrate, nitrates, GTNs, sublingual nitrates. Next, beta blockers, metoprolol, atenolol, propranolol. Why beta blockers? Beta blockers is it's try to decrease the demand. Try to decrease the demand. So so basically, there is a imbalance between demand and supply. No, so either you could increase the supply or either you could decrease the demand. So for the decrease the demand, we use beta blockers. When you use beta blockers, heart rate will be reduced. So when you reduce the heart rate, demand will be reduced. That's why beta blockers. Next, the calcium channel blockers, CCBs. CCBs, they dilate arteries and veins, so they decrease preload and they decrease afterload. So uh, also they will reduce the work of the heart. Next, the potassium channel openers, nicotine release the drug, mainly use in anti-anginal drugs. We mainly use talk about nitrates. Mechanism of action is increase intracellular sodium and smooth muscle relaxation. Smooth muscle relaxation. That is what is happening in nitrates. So main route is sublingual. You either you could use oral topical IV, but mainly it's nitrates. It's sublingual. So mechanism of action, nitrates. If you take this vasodilation, it's enough. Vasodilation, smooth muscle relaxation, vasodilation. So effects of the nitrates, it's venous dilation. When you dilate veins, what happen? Preload will be reduced, work of the heart also will be reduced, and coronary artery dilation, that's the main thing, coronary artery dilation. So imagine, so 70% 70% uh, from the coronary lumen is obstructed. So when you dilate, there's a 30% left no to go to blood. When you use nitrates, it will be increasing to 50%. You understand, right? Next, the cutaneous vessel dilation. Next, artery dilation and increased coronary flow. So mainly what we need to know is nitrates is coronary artery dilator. But it's not only coronary artery dilates, it dilate veins, it dilate arteries. It will dilate cutaneous vessel, flushing occurs. So pharmacokinetics, this is rapidly absorbed in sublingually, rapidly inactivated by hepatic metabolism in the pass metabolism. So there's a anginal pain, there's a um, no point is giving orally, because it's going through pass metabolism rapidly, and it is not well absorbed in orally. But it is more wise to give sublingually. That's why we use also in the under the tongue we give nitroglycerin sublingually. Indication, what is angina pectoris? Angina pectoris mainly. Next, acute MI and congestive cardiac failure, and also for the cyanide poisoning, also remember that cyanide poisoning mainly is angina pectoris, and also acute MI and congestive cardiac failure and cyanide poisoning. Side effects is postural hypertension and reflex tachycardia. These side effects are obvious side effects. You know this, due to smooth vessel dilation, vasodilation. Due to vessel dilation, the all the blood, main blood will be accumulated on the lower limb part, no, low part of the body. So due to that, also reflex tachycardia will occur due to the dilation, so reflex tachycardia. So when you talk about nitrates, you have to know about the tolerance. What is with the time, you have to increase the dose if you take these nitrates regularly. So that's why you have to use this periodically to avoid tolerance. Contraindications are what? Hypotension, increase intracranial pressure, and sildenafil. Sildenafil is nothing but Viagra. We use it is uh, to increase the duration of erection, and for impotence. Um, so this is sildenafil is basically doing is it will dilate the vessels inside your penis. So more blood will be accumulated on the penis. So when you're taking sildenafil and you're giving these nitrates, upon that it will dilate more, and more blood will be accumulated on the lower part. So less blood will be come to the heart, and less blood will be pumped to brain. So due to that, less blood, and fainting will be occur, you know, fainting will be occur. And if it is prolonged, the no oxygen, no blood supply to brain, and this will be severe consequences. Even death could be occur. So you have to know, uh, if you take sildenafil, like Viagra like drugs, for your increase enhanced sexual, whatever the reason, increase sexual performances due to impotence. And remember, you have to know that, when you're taking nitrates, it will actually will cause severe consequences. So that is the main thing. Contraindicated to sildenafil. Contraindicated sildenafil, which will dilate vessels. More blood will be accumulated in the lower part, and less blood will be going to your brain. mm, Severe consequences, infarction only. The brain cerebral tissue could only survive 5 to 6 minutes without oxygen. So only 8 minutes will be maximum. Neurons will going to be dead. So you have to know that. And in nitrates, you have to know what, it's sublingual. It will dilate vessels. In the anti-anginal drugs, you have to know it's dilate coronary vessels and increase the blood flow. Pharmacokinetic sublingual, rapid first pass metabolism, and indication is angina pectoris, acute MI, and cyanide poisoning and congestive cardiac failure.